Welcome. Each week I go through the data published about the coronavirus pandemic and do a statistical analysis to see what I think is going on. This video covers the results of that analysis for the week ending the 21st of June 2020. And I've subtitled this, Has It Really Gone Away? Because we keep hearing that the virus is on its last legs, it's in decline, numbers are going down. But I think the data I'm going to show you will persuade you that the exact opposite is true. Okay, first let's take a look at some of the topics we're going to cover today. There are some drugs that are now showing promise in treating very sick patients with COVID-19. We have new problem areas developing around the world, and we'll take a look at those. US cases are in the increase, despite what is being said by some. And the question keeps on being asked is, when will we get through the first wave of COVID-19? And I have an idea of how to calculate that. We have some good news at last from the University of Oxford in the UK. They have found that DEXAMETHASONE, a steroid, is promising in that it seems to reduce the deaths from COVID-19 by about 30%. Another good part of this is this is a cheap and widely available drug. It's used for many other things. But it only helps the most seriously ill patients, those that are on oxygen or those that are on ventilators. It does not help stop you from getting the disease or in the early stages of the disease. For that, we have to wait for a vaccine to be developed, and that's at least a year away. The COVID-19 pandemic map is continuously changing. There are a lot more areas getting involved, and many areas getting involved much more deeply. The darker the shade of red here, the higher the count rate. The US is still a major area of concern and is second only to Brazil in the number of new cases each day. Chile is not far behind, and Russia seems to be getting about 9,000 cases each day. Though it doesn't look it, India is having problems as well. So is Saudi Arabia and South Africa. If anything, the COVID-19 outbreak is accelerating. This red curve here shows the total number of cumulative cases worldwide, and you can see that it's bending upward rather radically. In fact, just a few days ago we had the largest single day total of any time during this outbreak. If we follow the trend from just a few weeks ago, we'd be following this dotted line here, and you can see that the actual trend has deviated to the left of this curve, which means it's accelerating. If we extend that curve out for a few weeks, we can see how soon we will get to 10 million cases. You can see that this curve predicts that we should pass 10 million before the end of June, whereas in the old curve it would have been somewhere in the middle of July, assuming that we didn't turn this curve over to the right and extend the time even further. So which countries seem to be managing this crisis worst, and which seems to be managing them best? We'll take worst first. These are the three countries that have over 50,000 cases in 1 week. Now that's more cases than over 200 countries have had in the pandemic so far in total. Those countries are Brazil with 235,000, United States at nearly 190,000, and India at just over 70,000. The countries with the largest percentage increase are South Africa at a whopping 38%, Brazil at 27%, Saudi Arabia at 24%, Egypt and Mexico at 23%, and India at 22%. So let's take a look at the countries that seem to be doing the best job at handling this virus. Let's take a look at the countries that have had under 200 cases in the last week. That's Ireland, Norway, and Australia. And if we look at percentages, under 1%, Italy, Ireland, and China. Now let's take a closer look at the United States. The states that are shown in deep red have a very rapidly increasing COVID rate. And there are 6 of those, that is Oregon, Montana, Wyoming, Hawaii, Alabama, and South Carolina. The ones in light red are increasing at a lower rate, but still increasing. The ones in the light fawn color are stable. The numbers aren't increasing or decreasing. And the ones in green, the numbers are actually falling. So you can see one of the things you can conclude here is that temperature is not really affecting the coronavirus at all, because all of the southern states and the southwest states, which are the warmest states, are actually showing increases, and some of them are quite significant. So this does not seem to be a temperature effect at all. Well, can we see any trends in the United States data? This is the number of new cases per day over the last few months. Now this green line shows the last measurement we got, which was yesterday, and that is quite consistent with the worst phase of the epidemic back in April and May of this year. Overall, we had a nice declining trend for a while. However, that seems to have gone away. And what we actually seem to have is, for the first few weeks of the outbreak, we had a fairly constant rate at about 30,000 a day. There was a short decline for a few weeks. Then it stabilized again at about 20,000 a day. And now, for the last 2 weeks, it's been on the upswing again. And that's the concerning part of this particular plot, that most recent upswing. That is not the second wave, that's still the first wave continuing. Some of you may recall the first time I showed this plot some months ago. This is two different definitions of death rates. The blue curve is the number of deaths divided by the number of resolved cases, which is the number of deaths plus the number of recoveries. The orange curve is the standard death rate, which is the number of deaths divided by the number of confirmed cases. Now these two curves should asymptotically approach one another as the number of unresolved cases clears up towards the end of phase 1. So where these two curves cross should indicate how long we will still be in phase 1. If we extend both curves at their current rate, that would say that phase 1 will end sometime in early August. With the coronavirus still accelerating and not under control, the CDC guidelines are even more important to follow. If you go out, wear a mask and stay 6 feet away from anybody else. And only go out if you absolutely must. If you touch anything communal like a hand railing or a doorknob or something of that sort, immediately go wash your hands and don't touch your face. Know the symptoms of COVID-19, and they do affect different people in different ways, so it may be any combination of the above. Persistent cough, fever, chills, muscle pains, sore throat, or difficulty breathing, shortness of breath, and a loss of sense of taste or sense of smell. You need to seek medical attention for people that have trouble breathing, persistent pain or pressure in the chest, show confusion, an inability to wake or stay awake, and have bluish lips or face. I hope you're all staying well and following these sage words of advice. So until next time, stay safe and goodbye.